So we're going to continue with our discussion of the treatment of the drowning patient. And when we last left, our patient was in the ambulance being transported to the hospital. And during this transport, the paramedics will be tending to the patient's airway, breathing, and circulation. And that's putting an endotracheal tube in that is intubating the patient if necessary, supporting the breathing with a bag valve mask and supplemental O2, and finally establishing IV access or IO access and giving IV fluids. And from here, the patient is brought to the emergency department where care will resume in the hospital. And while in the hospital, care continues with the airway, breathing, and circulation, the primary survey. And like the primary survey for trauma, our ABC is extended with A, B, C, D, and E. So intubation is recommended in any patient who's unable to protect their airway, especially from swallowing any vomit. So those are patients who are not alert, or maybe even their stomach is distended from swallowing water. Also with airway, just like in trauma, we consider the cervical spine. So place a cervical collar on any patient with head or neck trauma, such as diving injuries. Then for B for breathing, put the patient on supplemental oxygen with the goal of keeping the pulse ox above 92%. And you could do this with a bag valve mask, like an ambu bag, or maybe with an ambu bag and if they're intubated, or you may only need a face mask delivering oxygen. So for C, for circulation, you're going to start chest compressions and put the patient on the monitor. Most patients are going to be in bradycardia, pulseless electrical activity, or asystole. So you're usually not going to require defibrillations or cardioversion. There are rare cases where the patient may be in VTAC or VFib, in which case, of course, shock them. If the patient is hypotense, continue the IV fluids. If it's from hemorrhaging, if it's a trauma, then maybe you need to supplement with blood. D again stands for disability, or measuring the neurologic status of the patient, because the neurologic status is a very strong prognostic indicator. So calculate the GCS. And of course, E stands for exposure, and we're talking about temperature. And so you want to get a core temp, get a rectal temperature, because we know that drowning victims often have hypothermia, and so we may need to warm them up during the resuscitation. And paradoxically, we may need to cool them down after warming them up in order to perform hypothermia for neurologic protection after they've had return of spontaneous circulation. So after the primary survey is complete, you want to start the secondary survey, which consists of the history and the physical. So an important part of the history is the mechanism of injury. How did they drown? Noting any comorbidities that may be important. Was there any trauma or drug or alcohol use? Or was this an attempted suicide? And on physical exam, there are a couple very important things that we need to note. Of course, do a good head-to-toe exam like you would in any patient who's suffering from trauma. But specifically, we want to note the patient's neurologic status, as that has prognostic implications later. On the lung exam, note if there are any rales, especially are there some rales or are they everywhere, because this also has prognostic implications. On the cardiac exam, note any dysrhythmias that you didn't catch in the primary survey. And finally, is there any gastric distension from swallowed water? There's actually a data collection form from an Utstein consensus conference of all the information that you want to collect, which you can download and print out, and basically they're check boxes that note all of the factors we were talking about. It includes many things on there, like was this a witnessed drowning, what was the body of water, what kind of liquid was it, what was the temperature of it, how long were they there, how long did it take to get them out, were they unconscious, were they removed, did they require CPR, etc. And the subsequent workup should include the core temperature like we talked about, but also a blood glucose. Insert a nasogastric tube to remove some of the water from the stomach. A chest x-ray to determine the amount of pulmonary involvement, but noting that the radiographic findings lag clinical findings, and so they actually may look deceptively good now but get worse later. And you want to get an ABG to check the ventilatory status of the patient. A PaCO2, partial pressure of carbon dioxide, that is greater than 50 is a bad prognostic sign. Then you can get other testing as needed for the injuries, like maybe it was a traumatic patient and you need to get neck x-rays or other x-rays. You want to get a CT of the head if there was head trauma. EKG for the dysrhythmias, and urine and drug screens for the tox causes. Now, for the rest of this video, I wanted to go over a classification, a grading scheme for drowning victims from an article by an author named Spillman. And the first distinction we want to make in these drowning victims are they conscious or unconscious? Obviously, patients going down the unconscious branch are going to have a worse prognosis than those that are conscious. Let's first of all this conscious branch. And the next thing you want to know is, how are their lungs? Do they have rales or are their lungs clear? And of those with clear lungs, do they have a cough or not? Those with clear lungs and no cough are considered to have minimal aspiration risk, and if they have no other problems, they can go home, and they have about 100% survival. Those are classified as grade 0 patients. Those with a cough have a slightly greater aspiration risk, and they're probably still going to be okay, but you probably want to watch them a little bit so you observe them. Those are grade 1 patients, and they pretty much also have 100% survival. So now let's look at those patients who do have some rales, and the next distinction is, those rales mean they aspirated water. And so is it in some fields or is it in all the lung fields? Those with rales in only some fields are classified as grade 2 and have a 99% survival. You're going to want to watch them for a while because, remember, they can get worse with time, and then you may need to reclassify them if they deteriorate. But for the most part, you could observe them and then discharge them home. And then the next distinction is to check the blood pressure in those with rales in all fields. Is it normal or are they shocky? Is their blood pressure low? Those with a normal blood pressure are classified grade 3 and they have a 95% survival. Grade 4 are those who are in shock, but they have an 80% survival, and both of those should probably be observed in the ICU. Now let's move over to the unconscious patients. And you'll give them 5 breaths to see if they respond. Now, the first distinction we have here is whether they have a pulse or not. Those that are unconscious but have a pulse are going to need to be in the ICU and be on the ventilator, and they have about a 60% survival, and these are classified as grade 5. Now, for those patients that are unconscious and have no pulse, the next thing we look at is the submersion time. Was it more than an hour or less than an hour? And throw those who have any signs of death, even if it was less than an hour, in that same category as the ones that were more than an hour. So the ones that are less than an hour without any signs of death, we will classify as grade 6. They have about a 10% survival, so not very good. And they, of course, need continued care in the intensive care unit. And finally, those in that last category, greater than an hour of submersion with signs of death, are pretty much considered dead. They have almost no survival. You want to consider autopsy in those patients. Now, one other thing that should be mentioned is that hypothermia, meaning submersion in cold water, might mitigate some of these things. So maybe you have someone who looks like they're dead, but they were in really cold water. Warm them up first and then see where you are and reassess at that point. And the final piece we'll talk about is prevention. This should be the ultimate goal because most of these are avoidable accidents, and they could be prevented with adequate supervision, teaching, swimming, regulation, and public education. So things like swimming lessons, swim with others, like having a lifeguard there as well would be great. Avoid intoxicants while swimming. If you have a pool, fence that pool in, especially where you have young kids around, which is everywhere. And finally, public education on things such as what the drowning actually looks like. We know that it is improperly depicted on TV. So this is the end of the drowning videos. And again, I wanted to thank you for watching, and bye.